Hi student practitioners, welcome to All Medicine. I'm Dr. Raj Ariyaratnam, Academic Lead and Coordinator for All Medicine at the School of Dentistry and University of Manchester. All Medicine is a dental specialty based at the interface between medicine and dentistry. In other words, it bridges dentistry to medicine. All medicine is a discipline of dentistry concerned with the health of and diseases involving oral and paraoral structures. The specialty deals with medical management of diseases specific to oral and paraoral structures and of all manifestations of systemic diseases. It also deals with medical management of medically compromised patients. In Manchester Dental School, the oral medicine will be taught in 3rd, 4th and 5th academic years. Third year teaching is mainly focused on knowledge transfer and receiving information. Overall aim is to achieve an understanding the condition relevant to the study of oral medicine. The roadmap to achieve this aim is clearly outlined in our All Medicine Handbook, which will be delivered to the students at the beginning of the course. During the 3rd year, the course will be delivered in the case-based learning seminars. 8 to 10 students will be in each seminar groups. The common oral medicine condition and problems are catalogued under 8 main topics in this course. Topic will be covered during weekly sessions. The first part of the session is directly focused on knowledge transfer. This is achieved through tutor-guided group discussion, including PowerPoint presentations. The second part of the session will be spent on case-based learning. 4 or 5 clinical scenarios based on the topics will be discussed during this session. The student will play a major role in this learning exercise. The tutor's role is to guide them during the complex and difficult part of the journey. Third and the final part of the seminar is a practical session. This will be conducted in a clinical environment. The students will be encouraged to learn the practical skills individually based on the topic under the supervision and guidance of the tutor and the nursing staffs. The final 2 weeks of the course will be spent on revisions. During these weeks, the tutors may conduct a standard revision tutorial using slide, PowerPoints, or students will use this time to clear their doubt or update their knowledge through peer-assisted study session called PASS. During the course, the tutors will assess each student on their performance each week and give an appropriate grade with reasonable feedback. At the end of the course, the students are encouraged to complete a feedback questionnaire about the course. The response will be documented systematically to identify the strength and weaknesses of the course. You'll be able to use that to help us improve the course in the future. In the 4th year, the students will learn their trade solely at the oral medicine clinical environment. The student dentists will be given ample opportunity to translate their gained knowledge into clinical application on real patients. Each student will attend a minimum of 8 sessions. 4 to 5 students will attend each clinical session. During this time, they will learn about patient management in a step-by-step process. The patients will be purposely selected for these sessions. They normally represent the common condition and diseases in oral medicine. During the first 4 weeks, the objective is to achieve a reasonable standard in history taking and examination skills. In addition, they also indirectly will get training in communication skills, documentation skills, professionalism, and teamwork. During the second 4 weeks, in addition to history taking and examination, the student practitioners will be encouraged to formulate differential diagnoses based on their findings, and also to organize and execute special investigations wherever possible. During this period, they will also actively involved in writing patients' prescription either for internal or external pharmacies. During the final weeks, they will be encouraged to think and behave like dentists and take full ownership of the patients. During the final weeks, the tutors and nursing staffs will assist and guide the student dentist to achieve their full potential. During this period, in addition to clinical skills, they also achieve leadership skills by involving the tutors, peers, clinical and supporting staff. During the 5th year, the students in pairs will be allocated to either specialist-led cryo or biopsy clinics or NHS consultant-led clinics for 2-week sessions. During these weeks, the students practitioners will have the opportunity to observe, assist, and learn about management of complex oral diseases and biopsy and cryo procedures. During these weeks, they will also have the opportunity to meet the foundation year dentist and discuss about vocational training program and interview techniques. As in Harvard, the academic environment in our seminar rooms and clinics are anchored on self-motivation, self-learning, individuality, and drive for knowledge. Students are expected to work hard, look for challenges proactively, and achieve at their highest potential. While there is satisfactory framework of organization and supporting structure, in large part it is what students put into the program at every stage that will define what they take away. For some, this kind of approach initially can be frustrating, intimidating, and challenging. However, The long-term feedback shows the students appreciate this method on the long run. Overall, each student dentist will have a personalized guidance, enjoyable, productive experience during their time in oral medicine. We have a fantastic oral medicine team comprising excellent oral medicine teaching clinicians, senior nursing staff, and supporting staff. Our main aim is to support our student dental practitioner in every way possible and to guide them to become a compassionate and competent oral physician. Good luck.